Hi, I'm Dr. Sandra Elmer. I'm a urologist and a women's pelvic specialist, and I'm very proud to be part of the endota wellbeing conversation. I'm a urologist and I have a special interest in female pelvic medicine and reconstructive surgery. I love advocating for women's health and helping them through the journey, through life and all the different life stages they may face with their pelvic health. In this conversation, we explore how stress and nervous system activity influence pelvic floor tension. We'll discuss how chronic stress can affect pelvic muscles and share practical strategies that support relaxation and nervous system regulation. So the pelvic floor are muscles that run between the pubic bone at the front and the tailbone at the back, and they support all the pelvic organs. So the urethra and the bladder at the front, the vagina in the middle, and the rectum at the back. And they're all under the control of the autonomic nervous system. Now, the autonomic nervous system, that's the flight or fight response. So when you're stressed, the tension can be driven to your pelvic floor. It can create guarding reflexes, so the muscles tense in the pelvis to protect the body. We know there's a lot of sensory innervation in the pelvis that are connected to the emotion part of your brain, the threat part of the brain, and your pain part of the brain. So when you have stimulation in the pelvis, that can make the brain signal really strongly in those areas. So normal pelvic floor muscles, as you're walking around, are nice and relaxed. Your bladder may fill up with some urine and the pelvic floor strengthens a little bit to stop you from leaking. But then when you go to the toilet, everything will relax and you can pee and pass a bowel motion without any issues. Now, if you're chronically stressed and tightening up your pelvic floor, whether you're aware of it or not, or holding that tension in the pelvic floor, this can cause issues with your pelvic organs. So we call it hypertonic pelvic floor muscle dysfunction. And it can come across in a lot of different ways. Again, because of those organs that the pelvic floor support, the urethra, the vagina and the bowel. So women may experience constant pelvic pain or pelvic spasms. They may experience urinary issues, feeling like you need to pee constantly, have urinary urgency or pain when they try and pass urine because that pelvic floor is so tense around the urethra. They may experience sexual dysfunction because the muscles around the vagina are too tight. We call that vaginismus, where there's pain with penetration or even involuntary contraction before intercourse has even started. And then the bowels can be affected as well. So if the pelvic floor is really tight around the anal sphincter, women may find it really hard to pass a bowel motion, or they may not feel like they can completely evacuate properly. And in some women, when this pelvic floor muscle is so tight, it can just cause muscle pain or spasm, which can just lead to chronic pelvic pain, almost like having a tension headache in your pelvis. Psychological stress can contribute significantly to this syndrome of hypertonic pelvic floor muscle dysfunction. It might be past trauma, it could be current stress. And what can happen is that perceived stress can be generated or hyper experienced as pain in the pelvis, where you have almost like a guarding reflex and everything tenses up. And it just keeps driving itself over and over again. This pain that leads to stress that then leads to more pain, and it's a very hard cycle to break. The pelvic floor also plays a really important part of normal breathing. So the diaphragm, the abdominal muscles and the pelvic floor, when working together in harmony, keep a nice relaxed breathing pattern. But when you're very stressed and that breathing becomes shorter or shallower, not only can you feel that in your diaphragm or your abdominal muscle, but it can also throw your pelvic floor muscles out too. Some of the techniques women can utilise to help calm their pelvic floor are really simple. Deep breathing, meditation, relaxation and gentle stretching. Try and avoid triggers that may increase your stress around certain activities. And if you're really struggling or need some extra support, please find a really good pelvic floor physiotherapist, because they're really good at teaching you ways that you can relax your pelvic floor and stop them from spasming. Understanding how the body works helps us care for it more intentionally. Explore more simple ways to support your health and longevity with the endota wellbeing conversation.